In this slide, what I would like to do is show the stark contrast between a biofilm sample seen in health and one that is seen in disease. So if you're a dentist and you're not familiar to what some of these samples look like, or if you're a patient and you really want to see the difference between a healthy environment in a mouth and a diseased environment, this is a really, really stark example. The first thing that I want to point out is what we call motility. There's a lack of movement in the slide. This will become very evident when I show you disease. But when you look at this slide, you see bacteria. We all have 400 or 500 different types of bacteria in the mouth, but there is very, very little movement. The bacteria are not moving around, they're not spinning around. There's very little movement. It's a static sample. And so keep this in mind as we transition to the video of the disease pattern, which is coming up right now. Okay, this is disease. There is no not differentiating the difference. Those are spirochetes, the corkscrew-shaped bacteria. That's a massive spirochete infection. This is a combination of everything. There are spinning rods, gliding rods, spirochetes. A very rhythmic pattern. In some of these slides you're going to see, and what I mean by that, it's an organized group. This is a long-standing infection. This is not an infection that's new to the patient's mouth. It's been there a long time. Right up here in this area is a very rhythmic pattern where they're kind of going in wave-like. These are rods. These are gliding rods. Look at this as far as a rhythmic, and this is in your mouth. Okay, and this disease is transmissible, which very few people want to talk about. But by showing the contrast between the two samples, I want to show you how easy it is to make this diagnosis. This is another sample of organization. These are spirochetes, kind of in a circle. Once again, here these spirochetes are rather organized, and you see some gliding rods. There's one kind of shoot right through there. But very distinct.